Stroke, risk factors and prevention. A stroke occurs when the blood supply to part of the brain is interrupted or reduced, preventing brain tissue from getting the oxygen and nutrients it needs. This can cause brain cells to die within minutes. Strokes are medical emergencies and require immediate treatment to minimize brain damage and potential complications. Understanding the risk factors and adopting preventive measures can significantly reduce the likelihood of experiencing a stroke. This video drills into an overview of stroke risk factors and strategies for prevention. Types of stroke. Ischemic stroke. The most common type, caused by a blockage in an artery supplying blood to the brain, usually due to a blood clot or atherosclerosis. Hemorrhagic stroke. Occurs when a blood vessel in the brain bursts, leading to bleeding in or around the brain. This can be caused by conditions like high blood pressure, aneurysms, or arteriovenous malformations, AVMs. Transient ischemic attack, TIA. Often called a mini-stroke, a TIA is a temporary period of symptoms similar to those of a stroke. A TIA doesn't cause permanent damage, but is a warning sign of a potential future stroke. Risk factors for stroke. Non-modifiable risk factors. The risk of stroke increases with age, particularly after age 55. While men are generally at higher risk of stroke, women are more likely to die from a stroke. Family history. A family history of stroke or TIA increases your risk. Previous stroke or TIA. Having had a previous stroke or TIA increases the likelihood of another stroke. Modifiable risk factors. High blood pressure, hypertension. The most significant risk factor for stroke. Consistently high blood pressure can damage blood vessels in the brain. Diabetes. Increases the risk of stroke due to the damaging effects of high blood sugar on blood vessels. High cholesterol. High levels of LDL, bad cholesterol, can lead to plaque buildup in arteries, increasing the risk of ischemic stroke. Smoking. Smoking damages blood vessels and increases the likelihood of clot formation. Obesity. Excess weight, particularly around the abdomen, increases the risk of stroke. Physical inactivity. Lack of regular physical activity contributes to other stroke risk factors such as obesity, high blood pressure, and diabetes. Diets high in saturated fats, trans fats, cholesterol, and sodium increase the risk of stroke. Heart disease. Conditions such as atrial fibrillation, heart failure, and coronary artery disease increase stroke risk. Alcohol and drug use. Excessive alcohol intake and drug abuse, e.g., cocaine, methamphetamines, increase the risk of stroke. Sleep apnea. Obstructive sleep apnea can increase the risk of stroke by causing fluctuations in blood pressure and reducing oxygen levels during sleep. Preventive measures. Manage blood pressure. Monitoring. Regularly monitor your blood pressure at home or through regular checkups. Medications. Take prescribed medications as directed by your healthcare provider. Lifestyle changes. Reduce sodium intake, maintain a healthy weight, and exercise regularly to help control blood pressure. Control diabetes. Monitoring. Keep track of your blood sugar levels through regular testing. Medications. Follow your healthcare provider's recommendations for managing diabetes with medications or insulin. Lifestyle changes. Maintain a healthy diet, exercise regularly, and manage stress to help control blood sugar levels. Lower cholesterol levels. Diet. Eat a heart-healthy diet rich in fruits, vegetables, whole grains, and lean proteins. Limit saturated and trans fats. Medications. Take cholesterol-lowering medications, statins, if prescribed by your healthcare provider. Exercise. Engage in regular physical activity to help raise HDL, good cholesterol, and lower LDL, bad cholesterol. Seek support from healthcare providers, counseling, and support groups to quit smoking. Consider nicotine replacement therapy or other medications to aid in smoking cessation. Maintain a healthy weight. Follow a balanced diet with appropriate portion sizes to achieve and maintain a healthy weight. Aim for at least 150 minutes of moderate-intensity aerobic activity each week, along with muscle-strengthening activities on 2 or more days a week. Stay physically active. Incorporate physical activity into your daily routine, such as walking, cycling, swimming, or dancing. Mix aerobic activities with strength training and flexibility exercises for overall fitness. Eat a balanced diet. Emphasize fruits, vegetables, whole grains, lean proteins, and healthy fats. Reduce intake of salt, sugar, and unhealthy fats. If you drink alcohol, do so in moderation. For women, this means up to 1 drink per day, and for men, up to 2 drinks per day. Manage stress. Practice stress-reducing techniques such as mindfulness, meditation, yoga, or deep breathing exercises. Seek support from friends, family, or mental health professionals if needed. If you suspect you have sleep apnea, seek evaluation from a healthcare provider. Use prescribed treatments such as CPAP, continuous positive airway pressure therapy to manage sleep apnea, recognizing the signs of a stroke. FAST acronym. F for face drooping. One side of the face droops or is numb. A for arm weakness. One arm is weak or numb. S for speech difficulty. Speech is slurred or the person is unable to speak or hard to understand. D for time to call 911. If you observe any of these signs, call emergency services immediately. Strokes can have devastating effects, but many risk factors are controllable through lifestyle changes and medical interventions. By managing blood pressure, controlling diabetes, lowering cholesterol, quitting smoking, maintaining a healthy weight, staying physically active, eating a balanced diet, limiting alcohol intake, managing stress, and treating sleep apnea, you can significantly reduce your risk of stroke. Recognizing the signs of a stroke and acting quickly can also save lives and improve outcomes. Always consult with healthcare providers for personalized advice and treatment plans tailored to your specific health needs. If you received value from this video, please like, subscribe, and comment.